Welcome to Coffee with Dr. Stewart. This show will provide our listeners up-to-date medical information from a leading neurologist and neuroimmune specialist. Your host is Courtney Stewart, and your medical expert is Dr. Kendall Stewart. So grab your favorite beverage or cup of coffee, and let's have Coffee with Dr. Stewart.
Hi, everybody, and welcome back to another episode of Coffee with Dr. Stewart. I'm your host, Courtney Stewart, and today we're going to be bringing you an episode on fitness. But first, I got to ask Dr. Stewart,
Yep.
Dad, how are you doing today?
I'm fine, Coco.
Now, before we jump into this next topic, we want to answer a couple questions from our last podcast, which was on IVs. And so first, Dad, I want to ask, is glutathione as effective orally as it is in an IV?
Well, the answer is no. The biggest problem with making glutathione orally is that it smells of sulfur. So glutathione is a combination of 3 amino acids, and a couple of those actually contain sulfur, and that's actually how it works.
Okay.
So trying to make it palatable is not very good, and it is concentration specific.
Okay.
So trying to make it into an oral or even a lotion, we try to make it palatable, but really you can only get about 80 milligrams to maybe 100. Even if it's liposomal, it's just very difficult to get it to taste good enough. Now, taking it orally is good for your gut because it inflammation control, can clear toxins and stuff, but it's not going to treat the whole body.
Yeah, you don't absorb it as well.
And remember, when we're taking IVs, we're replenishing what's in the cell. So the cell makes it inside, but when we give a high dose of it, it replenishes all the glutathione that you need in the cell, so it's ready to do its job.
Yeah. Okay, next question is, can IV therapy help with brain fog related to long COVID?
Yeah, no doubt about it. So glutathione has 3 major purposes. One is to clear chemical toxins, and the second is to really get the oxidative stress out of cells. And we know for a fact that it helps with the nervous system tremendously. We've known that it helps with Parkinson's. It certainly helps with any type of mitochondrial deficiency. It helps with any kind of weakness, any abnormal thing in the cell. It also tends to decrease the most potent chemical messenger called interleukin-6.
Okay.
And it does decrease that. So in general, I think you have to go with that. Now, I like to mix it with IV vitamin C if you're going to go ahead and use it.
Yeah.
And but long COVID, there's just a lot of things to talk about with that, but in general, obviously, IV glutathione can help with that quite a bit.
Okay, third and final most asked question. Why do surgeons or anesthesiologists recommend Tylenol after surgery if it depletes glutathione in the body?
Well, the simple answer is they just don't quite know their chemistry very well. I mean, you got to understand they're recommending things that the drug companies have made. And so a lot of the drug companies make opiate preparations that also have acetaminophen in them. Now, the problem with acetaminophen, most people don't know that you can actually become toxic in Tylenol. Yeah. And the reason is the way it's broken down by the liver, it produces a byproduct in one pathway called NADPI. Okay. And that's actually toxic. And so that actually depletes glutathione in the liver very, very rapidly. And so if you take too much, and especially if you have a glutathione deficiency, you can actually poison yourself with Tylenol very quickly. And so in general, the answer is they just don't know. But I mean, the simple concept is if we can replenish the stores of glutathione, and we're going to be putting a toxin in you, which i.e. a medicine, anesthesia, et cetera, I mean, why not do it? So the answer is they just aren't aware of the chemistry because it's really not taught.
All righty. So we decided to choose this topic of fitness and functional fitness because it really is such a hot topic today. You can go on social media and find transformation videos. You can find videos on how to lose weight, how to get stronger, all of these different things. And so we really want to dive deep into what is fitness and the different ways you can do it and what works best for you. And so to talk about this topic, we have special guests, Bane and Gina Evans.
Yes.
So we have
Two of my favorite people.
Yes.
Yep.
They have been family friends for about 5 years. They're also our personal trainers. And so I want to ask y'all if y'all will tell us a little bit about yourselves.
Yeah.
Well, thanks for having us on the podcast.
Thank you very much. We love you guys. I'm
As
glad
you-
you're here.
Yes, glad
Happy
to be here. Yes. So a little bit about ourselves,
Yeah.
where we've been. Trying to not make a long story long. So my wife and I, Gina, we decided to open up Hill Country Movement back in 2019, right before the pandemic. We made it through that. We've been open for 5 years. We've been in the health and fitness industry for me going on 15 years, and how long for you?
I mean,
Longer than I have.
Yeah. Starting to push 20 years.
When we met Bane and Gina, we really, they taught me a lot. They taught me a lot about, what it is to really understand fitness at the right age. And in fact, they actually introduced me to the concept of functional fitness because, most of our clients that we see that are not, most of our clients who are young are pretty healthy. So our clients that are older but need to exercise, want to exercise, and all that type of stuff. Tell us a little bit about what functional fitness is.
I think functional fitness really is training for life. I mean, at the end of the day, training to live well in and outside of the gym, for activities of daily living as well as the things that move you outside of the gym. So whether it's, for your job or for your lifestyle, being able to pick up your kids or your grandkids, you need to be able to essentially deadlift or rearrange furniture in your house. You need to be able to lift and move things correctly.
That's right. We did that this weekend.
Squats to chairs and toilets. And we want to be able to continue doing that as we hit our golden years. And so there's a resilience, I think, that comes from training with that focus, to stay functionally independent, to maintain your physical autonomy.
Right.
I mean, these are the things.
It's a lot of balance, a lot of mobility.
Stability, flexibility, mobility. I mean, those are kind of fundamental pillars, I think, when it comes to just wellness in general, to keep people healthy and happy.
People who don't know this, you're still lifting weights. You're still doing a lot of body exercise, a lot of band work.
Strength and conditioning.
Yes, strength training is going to be very important, especially as you age. Think of it as like your savings account. So you want to have an excess amount of skeletal muscle mass or strength. That way, when we atrophy as we age, we are still able to do those functional movements. Squat, stand in the toilet, move, pick up grandchildren.
Yeah, pick up the grandbaby. I mean, seriously.
Be able to get up and off the ground, out of bed without too much issues. I mean, that's the, as we pan out, right? Like that's what matters, is having quality of life as we age.
Well, and that's what I think. I mean, I can tell you that when I tell people to exercise, I would tell you most of the time, unless they really have done it for a long time, they don't know what I'm talking about. They think, I'm going to go to the gym and I'm going to ride the bike a little bit and I'm going to wander around and do a couple of machines and then walk out. And, I can tell you for me, I was so burned out that I need some accountability.
And that's about 90% of why people get a personal trainer is the accountability. A lot of people have very busy schedules. They don't want to think about what they should be doing, how much they should be doing. You mentioned about finding workout fads or on Instagram,
Getting
TikTok.
sucked into the latest, greatest.
Yeah.
But that's just one workout where, you're working with a personal trainer. They have your whole wellness plan planned out. So it's a specific plan designed for you and your needs.
So tell us about your certification so that somebody will know what to look for in a trainer.
Bane and I, it's almost like finding native Austinites anymore. We have degrees in exercise science or kinesiology, so we've known that fitness was going to be a part of our career path for a very long time. And we wanted, to have that foundational education and have bachelors in that. And then we've acquired additional industry certifications over the years, personal training from accredited organizations. I've delved outside of personal training more so than Bane, and I've used to teach some group fitness classes.
Meals, body power.
I've spinning. I did a lot of things over the years before I kind of dedicated my time to more one focus. But
well, and I know you, Gina. I know that what's important to you, and she obviously trains a lot of ladies. Bane trains both ladies and men, but would be more men. And I see you working on form. I see you working on method.
I'm a stickler.
Well,
Stickler
and,
for performance.
and tell us about that. Tell us why that's
Well,
important.
I think when it comes to personal training specifically, folks are making an investment into their health and well-being, and it's not a cheap endeavor necessarily, right? But what greater investment can you make than in yourself? So because I have people for potentially a limited amount of time, 2 to 3 hours a week on average, I want to make sure that they are getting the most bang for their buck. And so not only does having an extra set of eyes on you while you're working out and making those like fine-tuned adjustments, that can make such a big difference in how people feel the movement, feel the exercise.
Or protect themselves from injury.
Absolutely, 100%. Because that's always a big concern for folks coming in. Yes, they need accountability. I always tell people, if you looked at a bar graph of the reasons that people hire personal trainers, accountability is by far the biggest one. But, in terms of, I don't know what to do, I don't know how much to do, I'm not sure if I'm doing this correctly, safely, efficiently.
Right.
I don't push myself hard enough to get the results that I want. Those are all other things that matter. And that's where personal trainers can help. So form and technique, absolutely. Let's keep you safe.
Yes.
Let's not run you into the ground and hurt you so you're scared to come back. Like, let's make this a mutually beneficial relationship.
Well, be honest, Bane. I mean, I lifted my whole life, and how bad was my form when I showed up in your gym?
It's a work in progress, but we're getting there.
Well, and that's the thing. It's kind of like to me, it's like a golf swing. I mean, you can be a golf pro, but they all have coaches because they get bad habits.
Yes.
And you can really mess yourself up in the gym. And I would tell you, and that's probably the big reason that people lay off, because not only boredom and accountability, but wind up hurting themselves.
Sure.
Or they get hurt and then they have to heal, but then they are too scared to reintroduce that same movement that they got hurt on.
Or
biggest one maybe is the deadlift, as you'd probably hear. That's probably one of the hot topics of I've been told never to deadlift, never train deadlifts, but we deadlift every day.
Yeah, what Bane's talking about is he actually had a client, and I'll tell the story so you don't have to, that they went to their doctor with an injury, and the doctor told them never to do those lifts again. And that was basically the answer.
Yes.
Not to do it safely with somebody who watches you or things like that. So.
And they had, maybe a herniated disc or a slip disc, but needless to say that you're going to be deadlifting at some point in your life.
Yeah.
You're never going to stop deadlifting something. The weight's going to vary, angles. And so still being able to train that movement is going to be very essential to longevity. And one is still build those muscles.
Well, the dog food.
Yeah.
The dog food out of the back of the car.
Yeah. Easily a 30-pound bag.
Easy.
Can you carry it?
Yeah, exactly.
And you talked about, loading the corn feeders for the deer feeds.
Overhead lift and
pressing overhead. Exactly.
Yeah. Putting a box up on the shelf.
Exactly. So you're always going to be running into these movements that are going to be high risk. So why not train for them safely and effectively and progressively? It's not like we're just throwing a bunch of weight on and just, hey, lift it. It's a progressive overloading process.
Well, and I think what people need to understand too is that, when we talk about strength training, there is a certain intensity that needs to be met in order to get results, right? And so that heavy lifting that people talk about is relative to the individual's needs and goals and abilities and where they're starting. So what you're lifting may not be what I'm lifting, what may not be what you're lifting, but it's heavy relative to what your capabilities are.
Right.
And we still need to push into that threshold to make a difference and stress the body in a good way.
Right.
And make those, gains.
Well, let's talk about soreness.
Sure.
Okay. So, from a physician standpoint, we talk about acute soreness versus delayed onset muscle soreness, which is a big topic, and that's how long do I stay in pain? And and that comes on, and obviously from that kind of standpoint, how do you guys address recovery? How do you address I read something very interesting that they kind of compared all the different recovery methods for delayed onset of muscle recovery, and they found out massage was the most effective. and stretching and active stretching and things like
Well,
that.
we definitely always say that recovery is training too. I mean, it's an
Yes.
important piece of a training program.
Yes.
And you can't go without that. But it's often a piece that's neglected.
Yeah.
So, you know,
Right
obviously,
here.
yeah. I mean, it happens, right? It's almost a discipline in and of itself. Same with stretching. You know, people like, oh yeah, this hurts? Do you stretch at all? No. You know. Okay, well maybe we'll start a little bit there. But it's you know, totally normal to be sore after a workout, 24 to 48 hours. In fact, we often joke that the 2-day sore can be a little worse. And that doesn't necessarily mean that you've done anything wrong. It just means that your body's catching up to what you're doing, what you've done, how you've progressed it past its normal.
And that's why things like massage or active recovery, as we call it, getting a casual walk in, getting the blood moving to those muscle sites, through the muscle sites, will help loosen that up, create that heat.
Motion is lotion.
Motion is lotion, is our saying.
No, I love that. Because, you know, a lot of us athletes can be sold anything, you know. A lot of people think cryotherapy. A lot of people think, oh, I'm going to get in an ice bath. But it actually, these papers were interesting because they showed that massage was far superior to even doing those types of things.
Sure.
Massage and sauna training on there, the heat, more of the heat training on there to help with that soreness.
Yeah.
And
So go ahead.
what do y'all think about, you know, some people say, if I'm not sore, then I didn't work out hard enough. What do y'all say to that?
I was literally about to address that too. I mean, we don't necessarily need to use soreness as an indication of a good workout, right?
No pain, no gain.
Right. That is not a philosophy that we adhere to by any means. In fact, I was talking to clients this morning about the fact that, you know, specifically for women, I do primarily train women and have over the larger part of my career, but you know, building muscle for women can be challenging because so many, you know, elements need to be aligned to maximize that result. Nutrition, for example, you know, making sure that they're eating enough is often a problem for women. But I think the hardest part and one of the biggest differences between training men and women is women don't often understand how much they're capable of.
Yeah.
And so I think of
And what's men's side
and men,
what's the
and
men's
men's
side?
egos are usually the problem.
You gotta
So
knock the men's ego
you have to
down
knock
a little
men
bit.
off the
boys are getting
pedestal.
hurt.
Exactly.
Doing
And
stuff.
like Bane said, deadlifts, you know, are one of those primary lifts that, you know, they just want to load the bar up and go heavy, but maybe they haven't necessarily.
Because I used to do it.
Well, yeah,
I used to do that much.
Your high school glory days or, you know, whatever. But we need to, it's that form and technique that comes back, right? It's like if I always tell my clients to warm up, practice as if the bar is heavy now so that it becomes this default when it actually does get to that point or that intensity. And so for women, you know, trying to build muscle and you know, more often than not, I'm like, put a little bit more weight on. You know, that looked great. You have a solid movement pattern. You've been consistent. You got the mechanics down. Add a little bit more weight because I'm going to push you to that threshold that maybe is more uncomfortable and you're not ready. You don't think you're able to do. Whereas the men usually have to.
Well, tell us a little bit about reps and sets.
Sure.
And what is your typical recommendation for women versus men? Because, you know, men are always, when we're young, we're always like max. Listen, I did a max of 1. I did a max of 3. I did this. You know, that's not what we're talking about here.
Not for the functional application, no. I think there's been some dedicated, you know, rep ranges, rest periods and things with 6 and less reps is more strength-specific training. Hypertrophy or muscle building can be like 8 to 12 and, you know, muscular endurance, 12 to 15, 15 plus. But anymore, what they're saying is that we actually need to work all of those ranges to maximize. You know, you're going to see the greatest benefit combining
them all.
Combining those different focuses.
Typically with a newer client, maybe that has not had experience in the weight room, we'll start them with that higher rep range, anywhere from the 8 to 10 range. One, you the weight's going to be lighter, so they're less likely to kind of hurt themselves, but they're also getting the movement pattern down of that particular exercise.
Right.
So we're kind of ingraining that in them with lighter loads over a period of maybe 2 to 3, 4, 5 weeks, depending on how long the program we are. And we want to progressively increase that week after week.
Right.
But usually we'll start a newer member off with the higher rep range with the lighter load.
So they're getting good practice reps in,
Yes.
right?
Yes.
Well, I know that we actually started with, I started, you and Mom started before me, I think, but I started with Bane during COVID, and we did some Zoom meetings, and I mean, I think we worked on mobility. We never touched a weight for probably many weeks. But he was having me do things that, shin boxes and all these types of things that we don't do.
Loosen up those hips.
Well, and that's the biggest problem, because what Bane found in me was my hip mobility, which is very classic for older guys. It was just pathetic.
Yeah.
Still is, but it's better.
Getting there. From the knees too.
We often joke that for our clients, obviously we ask what their goals are. What would you like to accomplish? What would you like to see happen? But as we get to know them and start working with them, we are also evaluating, where they're at, what they can do, how proficient they are at certain things. And so as much as we want to give our clients what they want, we're also going to make sure to give them what they need too, because that's the point of hiring an expert, is to, sometimes ask the tough questions, make you do the things you don't want to do, so that you're getting a balanced program.
And for the people who can't afford personal trainers, what would y'all suggest them to do if they're fresh in the gym? Videos, like what do y'all recommend?
Well, personal training has different tiers, if you will, because obviously you can work privately, which is going to be the most customized, focused, supportive approach. But, there's partner training, there's semi-private training, and that's one way that you can help
online training.
Yep, there's personalized online programming that you could do as well. But classes are another great way to kind of introduce with somebody at the helm movement. You'll have that social piece of it that it can be fun for people. Maybe they build community within that environment, and you start seeing the same people attending classes, and hey, I'll see you on Friday, right? And it builds a little bit of accountability that way as well too. So it all kind of comes back
it's
to
fun to go with friends.
It's sure. And for the social people,
and you can compete against them too, because I know your dudes compete all the time. Yeah,
and that's where the coach comes into play. And if someone needs to, adjust their weights or whatnot to something more appropriate.
Talk a little bit about balance. One of my expertises is balance and postural alignment and all that type of stuff. And how do you fold that into a workout? What do you guys typically recommend?
With balance, we kind of sprinkle that in there. Usually we'll use some type of single joint modality. So unilateral movements such as lunges, that could be a balance based, making sure they're not on that tightrope. Single leg RDLs. But we try
Romanian deadlifts.
Romanian deadlifts for
that stupid BAP board that you have me use, or whatever you guys call it.
Yeah, the Bosu.
Yeah, the Bosu ball where you're standing on this little half ball.
But yeah, we're just working kind of the intrinsic muscles to kind of help perform that balance, that central nervous system.
Well, that's the thing you're not going to get if you're just going to go to the gym and try to do it yourself. That's the thing that people are going to forget.
It's probably going to be something that's neglected, because maybe they don't necessarily realize how, like, they need it, but how to go about gaining additional balance too. And usually we think about balance for older folks. We always want to reduce fall risks and things like that. So it comes back to that, functional independence as we get older. But I mean, we run into 20-something-year-olds that struggle with balance. They don't have the stability. The muscles haven't been used in that way. And so you'd be surprised, I think, how many
So that's why you do single side isolations on a lot of them.
Well, we also, unilateral work is also a matter of training less dominant muscles to get stronger and, contribute. Contribute as well. So that's one way that we can help correct imbalances, muscular imbalances. But balance is definitely a thing that is in any well-rounded program, or it should be at any rate. To help, again, zoom out and give somebody what they need for the long haul.
Right.
Mm-hmm.
And where we kind of like to kind of put those is usually after your kind of compound movement. So say we may be working on back squats for that day.
Yeah.
So we'll start with a back squat, big compound movement, and then from there we'll go into more of the accessory work that will maybe focus on the unilateral work and balance based
Right.
on that. So it's not like our primary like starter piece, but we do like to incorporate that into everybody's program.
Right.
Mm-hmm.
We'll talk about aesthetics versus strength. I mean,
Good.
obviously, yeah.
So
'Cause, you know, I go to the gym because I want to look good.
yes. So aesthetics versus strength, you can
Yeah, do you
say
approach
this.
it differently, or
It's definitely going to be approached differently. You could think of this as bodybuilders versus powerlifters. Powerlifters, their main purpose is 3 lifts, max weight moved
For
We're-
one rep.
for 1 rep. That's overall strength. Now, if you look at powerlifters, you would not think that they're very aesthetically pleasing in a sense of like, oh man, they're super strong as they are.
Yeah.
And then you look at a bodybuilder where they're just more cut, defined, kind of sculpting. Think of Arnold Schwarzenegger,
Yeah.
right? The poster boy for bodybuilding.
Mm-hmm.
You look at him, you're like, oh man, he's really strong. But usually the powerlifters are going to be
Yeah.
stronger than the bodybuilders.
Yeah.
So the training program comes into the reps and sets that they go through. Where hypertrophy training, we're looking at breaking down that muscle tissue to create growth, hence the name hypertrophy. Where powerlifting, we're working the fast twitch muscle fibers to create a maximum contraction for that 1 rep to maximum load. So their training protocols are going to be a lot different. The rep range of a powerlifter is going to be a lot lower. The intensity is going to be a lot higher as far as load that they're going to be going. So they're working at 90% effort on their main lifts, where bodybuilders are going to be around that 65 to 70% of their max lifts.
Yeah.
So Bane and I actually met as personal trainers at the same gym who were both competing in
yeah, I wish I had
bodybuilding.
pictures of
Yeah.
it. I'd flash them up.
Bane's got some really great fake tan pictures.
Yes.
But so that, you're also potentially looking at, we think of bodybuilders as, split routines and things as well, because you're giving the muscles very, very targeted focuses so that you can not only grow them, but maintain proportion and symmetry and things like that too. So
Yeah.
it's a different approach.
Is it ever too late to start working out?
Absolutely not.
No way.
No.
Because I'm like thinking of like my grandma who's
No.
70, or
Okay, one of my favorite stories to tell is I had this older couple. They had come into the gym we were working at, and for her birthday, she had told her husband that she wanted to learn how to work out. She was 65 years old when she came in for her very first session, and she worked with me for probably a good three or 4 years. We're still friends to this day. But it was the sweetest thing, and I thought it was so incredible that, especially as a boomer age woman who probably didn't get much opportunity to do those sorts of things, lift weights and strength train. And she came in so open-minded and just ready to work, and it was really cool to see. And so at 65 years old, for the very first time working out ever, no, it's never too late.
Yeah.
Something is always better than nothing.
And it's funny that you say that is sometimes if you start later in life, you see a lot more progress. For those that maybe grew up playing athletic sports or very competitive sports where they beat down their body very early on, they have a lot of injuries that prevent them to maybe pushing hard or working out. Where someone that's very new, they're very coachable. So they're able to go through the movements more safely. They progress a lot easily. And so you see a lot of progress in individuals that start maybe a little bit later in life.
Yeah.
So.
Well, just for everybody to know, that beautiful baby sound in the background is their beautiful baby boy. And since I love babies, I told him to bring it. And so don't be distracted because he is a very handsome man.
Yes, we do have a 7-month-old here with us.
Okay, now I want to get into the genetic side of working out. So, Dad, I want you to kind of go into detail about the diet and wellness panel. some different SNPs that are in it, and then also inflammation control.
So really, if you're talking about working out, the biggest problem is, I tell all the athletes, especially the younger athletes, it's not the workout, it's the recovery that actually gives you the gains. Mm-hmm. The problem is it's different people have different abilities to control inflammation. And so from a genetic standpoint, if we have somebody who's, overtly abnormal in genetics and creates a lot more inflammation, they literally can work out so hard that they literally make themselves sick because the inflammation is so severe. And so getting genetics can help us identify how we can prepare that patient to actually start a more aggressive program or prepare themselves to do something that they will get the most success out of. Yeah. So I like to say you're never going to run a marathon if you didn't run down the street. I mean, it's just not going to happen. So genetics allows us to essentially go in there, see how your inflammatory markers are, and then give us an ability to actually manipulate those even before you step in the gym so that you can understand and expect a better outcome.
Yeah. Do you have a certain group of people that you would suggest to get this type of panel?
I think the older you are, you guys can certainly correct me on that, but the older you are, young men have lots of testosterone. They can handle inflammation well. Young women, they have great progesterone, which handles most of theirs. The problem is we know that injuries are more common right before women's periods and during their cycles from an orthopedic standpoint, knees, ankles, etc. So in general, I think understanding more about their genetic risk analysis, that we can prepare them, and their trainer, their physician, their provider can help them actually deal with some things that will help with their inflammation control, and they'll get more out of their workout recovery.
Okay. And then y'all can also go back to the inflammation podcast that we recorded and get more detail on inflammation control, how you turn it on and how you turn it off.
You guys tell us. You obviously see some people that struggle to get back in the gym and they come in really sore and all that type of stuff. How do you guys deal with that?
Yeah, kind of like what we mentioned earlier, motion is lotion. So get them a proper warm-up, get the blood moving for one. And like you mentioned, your progress isn't going to come from that one workout. It's from the recovery. Right. So that's where all these supplements and, ice baths is how fast can we recover and heal the body so we can go back to the workout or training again. Right. Whether it be for the sport or for just longevity. So if we can manage the inflammation control and speed that up through, proper genetic testing. So like I know I, get more inflamed on certain things and I can take supplementations to help with that. Yeah. That will help with my recovery. That way I will be able to push a little bit harder in the gym and not be as sore or broken down.
Knowledge is important, because if I can see what's going on with you, we can tailor and custom tailor it. And I think as Bane and Gina get more into genetic testing, they're going to be able to custom tailor their clients a whole lot better. Yeah. And you don't want to overload them with supplements. You just want to get the right ones. And that's what's important with genetics. It tells us what we need, but it just as importantly, it tells us what we don't need. Yeah. And we don't want to waste money and time and effort if we don't need it. Mm-hmm. And you're not going to be successful with it. Because obviously everybody's coming in to turn over a new leaf.
All right. Well, I think that wraps up this episode. Thank y'all for joining us for another episode of Coffee with Dr. Stewart. Make sure you follow us on all of our social medias and be sure to ask any questions that you have from this episode, and we'll be sure to answer it in future episodes. Thank you and be blessed.
This show is for entertainment purposes only. Please do not use anything mentioned in this show as your own medical advice. Please discuss all medical issues with your own provider.